to A Girl in Love with Tech podcast. My name is Rachel Irabor. I'm a Power Platform advocate and a Microsoft Learn student ambassador. Our speaker for today is Paul Swider, who have seen a lot. Yeah, hi. I've seen a lot of his posts on Twitter and LinkedIn where he talks about Power Platform, and also he talks a lot about healthcare in Power Platform and the community he's a part of in Power Platform. They do so much in healthcare, and I said, okay, why not invite him and talk about healthcare in Power Platform? So, hi, Poseidon.
Hello, happy to be here. It's an honor, and congratulations on the new podcast, by the way.
Thank you very much. Thank you. Okay, so for today, we're going to be talking about healthcare in Power Platform and our speaker for today. So if you can introduce yourself so that we can know more about you.
Sure, I'd be happy to. So my name is Paul Swider. I'm currently based out of the Boston area. My focus today is primarily focused on the Power Platform, which encompasses also Dynamics 365 community is part of this, and things like Cloud for Healthcare. And so yeah, gosh, a little bit more about me. I started my career, I'm almost embarrassed to say, almost about 30 years ago.
Wow, that's
And
amazing.
yeah, it was a while ago. And one of my first really cool projects in technology was to help with Y2K. And so we
Okay.
started that in 1998 because we wanted a couple of years to help us prepare for
Yeah.
fixing the problems with dates and embedded computers. And so I was actually recruited by a large hospital to assist in solving this issue. They had some devices with some potential date problems they wanted me to look at. And
Yeah.
that's what launched my career in health in clinical informatics, and I I think I would have been involved in technology either way because I went to school for
Yeah.
computer science and I was really interested into computers. But that's what
Okay.
really started me down the path of healthcare. And then so immediately following that, I actually created a platform that was used on the clinical side of healthcare for another large hospital. And
Okay.
in short, we were doing AI sort of before AI. So we were
Wow,
doing the
that's
best we could
amazing.
at the time with branching and logic. So, we would
Yeah.
pull from multiple systems in the hospital. And then what we did that was really cool and pioneering ahead of its time is we built on Windows CE the very first handheld application for patients to use on a Wi-Fi
Wow.
network. So yeah, it's really cool. As a
Yeah,
matter
I
of
mean,
fact,
that's really amazing.
yeah, and what was the other thing that was neat about it is they actually put the very first Wi-Fi network in the very first hospital in the United States just so they could run this application. So I sort of have that claim to fame as well. And then so then after that, my next big project in healthcare was I worked as the lead consultant for another project, which was creating an electronic health record. And
Okay.
so
Yeah, lead,
those
is
are
that in Power Platform or in healthcare?
no, that was actually at the time we did that in .NET. So this was before
Okay.
Power Platform even existed. This was about 10 years ago. And
Okay.
then, but to your point, my most recent work is that in healthcare that does involve Power Platform is that
Yeah.
we have a product ourselves. We have a SaaS product. Part of it runs on and integrates with Dataverse and Power Platform. And essentially what we do is we focus on provider burnout and pay
Okay.
equity and compensation management for providers and nurses. And that's
Man, that's really
that's the
amazing.
most recent stuff that involves Power
Yeah.
Platform. Sorry to interrupt. Go
Yeah,
ahead.
that's amazing. So I wanted to ask you, like, how did you start your journey? Because I understand that you started your journey with healthcare. So how did you get into Power Platform?
Yeah, no, that's a really great, interesting question. Essentially, what happened, and it might sound funny, but I had got to a point in my career where I had moved down to Puerto Rico, and I
Okay.
was thought I was almost not retired, but I was working like part time. I was enjoying the
Yeah.
Caribbean and cut back on my work substantially. I had been traveling all around the world previously for years and was a little burned out. And long story short, we had Hurricane Maria in Puerto Rico, and it flipped my life upside down a little bit.
Yeah.
And what I decided after the hurricane was that I would come back to the Boston area
Okay.
and pick up some intellectual property that I had developed with Dartmouth Hitchcock Medical Center in New England,
Okay.
and try to turn that into a product. And so
Yeah.
that's what brought me to Boston. That's what, and so so we had already developed this product on-prem, but we wanted to migrate it to the cloud. And so that's when I
Okay.
really started looking at Dynamics and Power Platform and Dataverse,
Wow.
because I thought it would be the best business front end for our application. And so that's how I started my official journey into Power Platform and Dynamics
That's really
platform.
that's really amazing. With your post on Twitter and LinkedIn, it's got me really curious because you can't just imagine it that okay, Power Platform is actually doing so much in healthcare. And I've spoken to a lot of persons, like when I teach classes on Power Platform, I've spoken to a lot of persons that they are into healthcare, maybe they are nurses, pharmacists, and stuff like that. And when I talk to them about Power Platform, most of them they are interested into going into data analysis because they think that maybe they can use it in their careers, like as being in healthcare. And I spoke to them about Power Platform. They are like, what can I use Power Platform to do? So I said, okay, so I'm going to drag you here and I'm going to talk about what they can do,
Yeah.
what they can, we're going to talk about what they can actually do with Power Platform. So for our listeners who this is the first time they're hearing about Power Platform, so what can you tell them that what Power Platform is?
Yeah, sure. So I think there's a couple of things to remember. I think first we should just let's talk about some definitions a little bit,
Yeah,
and so what I mean by that is first we should acknowledge that there's lots of different types of organizations in healthcare. So
yeah,
typically when somebody mentions the word healthcare, the first thing you think of is a hospital.
yes,
But
yeah,
there are other healthcare organizations as well. For example, in many parts of the world, we have insurance companies that are
yes, we
responsible for
do.
paying for the healthcare.
Yeah,
We have health life science, which is more centered around research and
okay,
genomics, and maybe clinical trials might fall a little bit under health life science. I think they're unique, and
okay,
they might cross multiple boundaries. And then you have places, for example, that do labs and X-rays, right? And they're
yeah,
individual, separate from the hospital oftentimes. As a matter of fact,
yeah,
there are many private
private,
companies that do this. Yeah.
yeah,
So I think first it helps to just acknowledge that we have all these different types of healthcare organizations. And then if we were to specifically talk about hospitals and clinics where patients are actually being treated, then I also like to
yeah,
remind folks that there's two sides to the technology that's used in a hospital. The
yeah,
first is what I like to call the operations side, which is you can
okay,
think of this as like the business side of running the hospital, like HR,
yeah.
finance, operations,
Do they
keeping the
have anything
lights
like
on.
receptionists?
Yeah,
Do they have
exactly.
anything like
Right.
receptionists? Yeah. Okay.
Yes. And then on the other side, you have your clinical applications and technology. And so I like to think of
Yeah.
clinical applications as essentially it's all of the applications that the doctors and nurses use to treat the patient. So any
Okay.
application or technology that the doctor, the nurse, or the patient interact with would be referred to as
Yeah.
a clinical application. And so when
Okay.
we talk about Power Platform and the opportunities in healthcare, there's actually
Yeah.
a lot of opportunity depending on the organization you're talking about, and also
Yeah.
whether you're looking at helping streamline operations or help with the clinical side of things. So it's a
Okay.
complicated story, but that's how I like to start talking about Power Platform in healthcare. Just coming up with
It's
some
amazing.
solid
Yeah, breaking them
definitions and
down.
stuff.
Yeah, it's
Yeah,
amazing.
and
Yeah.
and so if getting back to now to the heart of your question, if you think about the operations side,
Yeah.
Essentially all the stuff that people are doing today with Power Platform, workflows and automation around and custom apps around human resources, finance, helping to automate
Yeah.
the inventory, whatever it is, security gates, cafeterias,
Yeah.
all
There's so
that
much.
stuff is
Yeah.
relevant in healthcare. Yeah.
Wow. Really? That's nice. That's awesome. Because I was thinking that since it's healthcare, the solution is going to be so big and different.
No, no. As a matter of fact, I think one of the really cool things about the Power Platform in healthcare is that it certainly can be very big and complex, meaning that we have to remember
Yeah.
that the Power Platform includes Dataverse, which is built on top
Yeah.
of something called the Common Data Model, right? So we have the Common Data
Yeah.
Model,
That's true.
and then we have
Yeah.
Dataverse. And then on top of that, we see things like Canvas apps and Power
Yes.
Apps, right? What we used to call Canvas apps.
Yeah.
But then there's also the dynamics layer on top of this. And then a lot of
Okay.
folks are just learning now there's even another layer. And that very top
Wow.
layer at the top is called Industry Cloud. And so there's something called Microsoft Cloud for Healthcare, which is, again,
Okay.
sits at the very top of Dynamics, but ultimately it's built on the Power Platform in Azure. And so these folks that are using the cloud for healthcare, you're right, these tend to be very, complex scenarios,
Yeah.
etc., complex solutions, but they can completely be customized with the Power Apps and Power Platform that we all know today.
Okay.
And then,
Yeah.
and then certainly, if we look at the operations side of things or building some stuff on our own to help clinically, we can do all of that without cloud for healthcare as well. So candidly, there's a lot actually that you can do with Power Platform in healthcare.
Wow, like I'm learning so much from this because it's the first time I'm hearing about Microsoft Cloud Healthcare, and that's pretty amazing for it to be a part
Yeah.
of Power Platform. Yeah.
It really
So
is.
like
It's something I'm excited about. I actually have been really honored lately because I'm working with the Cloud for Healthcare team at Microsoft in Redmond. As a
yeah,
matter of fact, I will be traveling out to Redmond in 2 weeks. I'm teaching,
that's
I think,
amazing.
20 MCTs. The very first
Wow.
Microsoft Cloud for Healthcare course is focused at architects. Microsoft's making
That's
a
really
very big
cool.
investment. Yeah, it's very exciting.
That's really really cool because for healthcare, because when I was thinking like what I said when I was thinking about healthcare, like Power Platform in healthcare, I was thinking that okay, it's going to be so big, like you cannot just comprehend it, you understand? And when I have a lot of questions about Power Platform on healthcare, I do not have any like solutions, example of solutions I can give them because I've not really worked in healthcare. I mostly just I started my journey last year and I'm still coming up. So like I have questions like can you give like an example of a solution you built with Power Platform on healthcare? Yeah.
Yeah, I think I think the best example to probably give is our product that we actually sell now to hospitals.
Yeah.
And so again, this is we refer to it as our real activity provider experience platform, and we focus on
Yeah.
compensation management and pay equity and provider burnout are a couple of the areas that we focus on. But essentially, what
Yeah.
we do is we pull from multiple systems in the hospital, including the
Okay.
HR system, the contract system, the grant system, the electronic health
And
record.
you do all of this with Power Platform?
What we do a lot of it in Power Platform from the
Man,
user
that's
experience
amazing.
perspective, but we
Yeah.
do use some SQL Server and some Azure as well. But we use
Okay.
Power Platform for the user experience side, right? So the interface with our,
Okay.
with our platform. Yeah.
Okay, so I want to ask you, like, I want to tell you that what advice do you have for like a person who is interested in coming into Power Platform, but the person is actually in the person is actually in healthcare, and the person is thinking of using Power Platform, bringing Power Platform into healthcare. Like, what advice do you have for them? Where do you think they can start their journey in Power
Yeah, so
Platform?
great question. So I would a
Yeah,
couple of things, and I'll share some links with you so that when you
yeah,
publish your podcast, maybe we can put these links in the description to help people.
so that would be
Um,
amazing. Yeah,
Of course. So first,
Yeah.
I'm actually proud that I'm one of the founders of something called the Boston Healthcare Technology User Group, and we
Yeah.
do twice a month. We do meetings where folks from Microsoft and the community will talk about
Yeah.
healthcare technology, and oftentimes we
Yeah.
do cover Power Platform as part of this group. Now, also, we should also share a link because there is some really great new content on Microsoft Learn that's specific
Okay.
to Power Platform and healthcare. And so
Wow.
if you just
That's really
Google,
cool.
yeah, I
Yeah.
would highly recommend it. It's great
That's really
content
cool.
as well. Yeah,
Yeah.
it's really good. And it will, there's even modules that will show you how to do really advanced things, like how to use Power
Yeah.
Platform to integrate with something called Fire. So Fire is
Wow.
FHIR, and this is a
Wow.
standard that a global standard that folks use to get at electronic health data. And so there's some
Okay.
really great documentation and learn modules about how to use Power Platform with this standard called
Yeah.
Fire.
Yes.
Yeah, as well
Yeah.
as a bunch of other
This is the first
stuff.
time I'm hearing about it, so I'm learning.
Yeah, you
I know
should
this is the
really
first
check it
time.
out
Yeah.
if you're interested in healthcare. I can't tell you, and I can't speak highly enough about the content. And we all know
Yeah.
that Microsoft Learn is great for learning anyway, regardless of the
Yeah, it's pretty
platform.
great.
Yeah,
Yeah.
but the healthcare content is really great, and it's all fairly new. It's fresh. I highly recommend it. If so, your question was
Yeah.
those people interested in healthcare. How can I learn more about the Power Platform in healthcare?
Yes.
And that's the advice I would give. Yeah.
Okay. Do you think that's for you, like, what do you think that Power Platform is something that any person should adopt as a skill set?
Yeah, well, I think it depends, right? So it's sort of easy to say that, but I think we make some assumptions if you're going to use Power Platform. Like for example,
Yeah.
you're using Microsoft software, right? But we should
Okay.
acknowledge there's lots of folks that use other platforms and whatnot, right? Or that for whatever reason they might
Yeah.
not have access to Power Apps and Power Platform. But if we
Yeah.
assume that you're using Microsoft technology, or I
Yeah.
guess, in all fairness, if you want to extend your solutions using Microsoft technology, then I think yeah, no, I think it's very important that you look at Power Apps, and I mean that at different levels because the interesting thing about Power Apps is that it's very encompassing. There's a lot to it, and so
Yeah, there is.
right. And as you know, it could be as simple as using Canvas apps to create some collaboration type of solutions
Yeah.
with SharePoint lists, right?
Yeah.
But it
Yeah,
could
that's
also
true.
be a little more complicated where you're using Dataverse and Power Apps
Yeah.
to build or extend line of business applications, right? So
Yeah. Even modern driven apps. Yeah.
yeah, and then, if then I would add one more thing. I think the other reason why folks should look at Power Platform if they're working with Microsoft technology is that
Yeah.
if we look at the business apps industry, right,
Yeah.
there are many big players, and so some of the top ones include Microsoft, SAP,
Yeah.
Oracle, right? These are
Okay.
Workday now is very competitive, and all of
Yeah.
these folks, Salesforce is another one, and all
Yeah.
of these companies are very intensely pursuing the business app space, right?
Okay.
Now,
Yeah.
what I would submit is that what gives Microsoft a competitive advantage against these other vendors is that they
Okay.
have the common data model in Dataverse. So what that allows them
Okay.
to do is it allows them to extend their line of business applications very
Yeah.
easily to Microsoft Teams, Microsoft
Yeah.
365,
Different. Yeah.
SharePoint. Yeah,
Yeah.
and that's a
That's
really big
that's another
advantage.
thing. Yeah, that's another thing why I love Power Platform. Like when you're trying to connect to other applications or external services, it's just very easy. Especially all those tools that have authentications, you just have to sign in. You don't have to go
Yeah.
through a very long process in order to connect your data to your
No, you're
application. So it's
absolutely
completely
right.
amazing. Yeah,
That's a great point.
that's yeah. And one other thing for our listeners to notice is that maybe you are coming into Power Platform, you're starting your journey in tech, or you want to come into Power Platform, you can easily use your Microsoft 365 developer account. So maybe you're not working in an organization yet, or your organization is actually not using a Power Platform license. So you can practice and build projects with your Microsoft 365 developer account. So there's one thing
Yep.
I want to that like we talked about your user group. I really want to know much about it because I see a lot of posts. I see a lot of things you guys are doing on Twitter, on LinkedIn, and there's
Yeah.
a time you guys actually invited Donna Saka to talk about accessibility in
Yeah.
healthcare. Yeah, and I actually attended on LinkedIn. Like, I want to, how do you do it? Like, I want to really know because it's pretty amazing to be able to work with healthcare, to talk about so much about healthcare. Yeah,
Yeah. Candidly, it's not me. We have a really good team. We have
yeah,
Donna Torres is a Microsoft MVP and our community
okay,
manager, and she drives a lot
yes,
of the work behind the Boston Healthcare Technology User Group and the
yeah,
Boston Power Platform community. And
yeah,
then there are heroes in the community. I would consider Donna Sakar to be one of those heroes.
yeah,
What's interesting about Donna is I had a very brief conversation with her at the Scottish Summit about 6 months ago,
okay,
and I explained
yeah,
to her, my view on why accessibility was so important in healthcare. And in short,
yeah,
if you think about it, many patients will have some
yes,
sort of potential problem or limitation in function, right?
yeah,
That's probably why they're at the
yeah, that's
hospital.
true.
And
Yeah,
so Donna was amazing. She immediately she had already known this. I could tell just by speaking to her, and she was very
yeah,
quick to volunteer to speak to our global community about
yeah.
accessibility in healthcare. And so, it's all these other great people. I'm just sort of helping put it all together and try to be a little bit of a leader. But the reality is there's lots of people, even people like yourself, that take an interest in what we're doing. And then the next thing I know, I'm doing a podcast with you talking about healthcare. And, maybe next month you can come present for our group, our Boston
That would
Healthcare
be
Technology
awesome.
User Group. That would be amazing. And so,
Yeah, that would be awesome.
yeah, of
And
course.
you
We
guys
have an
are doing
open.
and you guys are doing so amazingly well. Like I see so much on your post online. I see what you guys are doing and you guys are amazing. Like you guys are seriously amazing. And it's really
Well,
great because you are actually opening doors for people and also giving people the knowledge. Like you're trying to tell them that okay, this is possible, you can do this, you understand? So it's pretty
yeah,
amazing. I love it.
and I
Yeah.
appreciate that. But again, there's a team. We also have
Yeah.
another person on our team, Tresha. I should mention Tresha Quenza, and she
Yeah.
also does an amazing job with our social media, and getting the word out
Yeah, you
there.
guys are amazing. Yeah.
Thank you. I
Yes.
will forward
Yeah.
the compliments to them. They deserve that. Again,
Yeah,
I just show
definitely.
up for the meetings and
Definitely
try to be a
forward
little bit
it.
of a leader.
Yeah. Yeah, definitely forward it. That Rachel is actually complimenting them that they are doing amazing.
I
Yeah.
will.
Thank
Thank
you very
you.
much. Yeah.
Of
So thank
course.
you very much to our listeners. Like this podcast is available on Spotify, is available on Google and also on Anchor Podcast and actually also my YouTube
Wow.
channel. Don't forget to like and to subscribe.
That's
So
amazing,
thank
Rachel. Good for you. And I'll make
yeah,
sure I
thank
give you some links
you.
to put in the description as
Okay.
well.
Sure, that would be amazing. Thank you. That would be really great. So thank you very much, everyone, and see you on the next podcast.